Resisted range of motion can be defined as voluntary isometric contraction of a muscle attempting to perform a physiological or osteokinematic movement. Resisted range of motion assesses only the contractile tissue within the physiological range of a joint. It does not provide information about specific muscles. So, what are we noting during resisted range of motion? We're noting the associated pain with the contraction, the amount of strength, and the patient's ability to control the movement. How do we perform resisted range of motion? First, position the joint in neutral position. This ensures that you are testing only the contractile tissue. Second, you will ask the patient to hold the position against gravity. Third, you will determine if the patient can hold the contraction against gravity. If successful, ask the patient to resist your attempt to move the limb. You would say, "Don't let me move you." Then you'd apply a steadily increasing force or resistance over a 5-second period. Then, slowly and gradually release the force. Grade the strength of the movement and if pain was present. When you are grading strength, you will use this scale. A grade 5 strength indicates normal movement, where the person can overcome maximal resistance in that movement. A grade 1 will indicate a very slight contraction, but there is no movement with the associated joint. What might resisted range of motion reveal to us? Once you've performed your movement, if you determine the movement to be strong and painless, then there's no lesion to the muscle, tendon, or nerve. If you've determined the movement is strong and painful, then there's possibly a first or second degree muscle strain or tear. This is a minor lesion of the contractile unit. If you've determined that your movement is weak and painful, there is a partial but more severe muscle strain or tear. This is a result of inhibition from inflammation, fracture, or pathology. If the movement is weak and painless, there is possibly an interruption of nerve supply or a complete tear of muscle or tendon.